compared to New York,
Not the
so
individuation.
8,000.
So
Hopefully,
Senate, please come to order.
Always.
Take a moment of silence and move devotional. Thank you. Are there any announcements? Seeing none. Orders today. Senator from Chittenden.
thank you, Mr. President. I was hoping, as I tried to lay out yesterday, that we would finish our work on the budget with the third reading, then move to the yield bill, and then proceed to the top of the calendar.
So we will start the third reading on page 951. Are there any amendments prior to third reading? Senator from Washington.
Yes, the Senate, well, actually, the members of the Senate Appropriations Committee have a kind of technical amendment, 4 instances that we would like the Senate to consider. I have a version that's slightly different page numbers and things, but so I'm going to wait till I get the handout, see if I can align them. But what we're doing here, the main thing that we're doing is, I think, 3 of the 4 amendments in here take language from the T-bill, or take language basically from the T-bill about how we're dealing with the pilot funds and puts it into the budget, because they really deal with the pilot funds, which is an appropriation issue about how these pilot funds are getting spent. This would be something that's in the budget and worked on with the conference committee of the appropriation, the budget committees. So we're going to take these sections out of the T-bill, or we're putting them into the budget, and that's where they will rest and be dealt with. So that's the first instance of amendment dealing with the pilot funds. You'll hear about this in the T-bill, but basically it takes $3 million out of the pilot fund, that's some of the surplus, and puts it through the state highway program. So that has money going out to the towns. The towns have issues around making their budgets for just basic road maintenance, let alone bigger projects like bridges. So this will take $3 million and distribute it along the current formula for town highway aid to all the towns. That's the second amendment is a correction. So the second amendment doesn't have to do with that T-bill. This was a cut and paste error from the list in the capital bill. There was one issue, the $500,000, which was O in the list for renovations of the Chittenden Regional Corrections Facility, was listed twice. And K, the $500,000 for the Agency of Human Services for the Newport Northern State Correctional Facility sprinkler system upgrades wasn't there. So we added in the sprinkler system upgrade for the Newport Correction Facility, and we took out the double line, the $500,000 for the Chittenden Regional Correction Facility. So the numbers still equal, but it's just making that correction. The third instance of amendment is adding language to the budget around the continuing care for homelessness so that this can be discussed in the budget conference committee. This deals with in the budget, we had this full $21.1 million kind of set aside for discussions around H938, I think the bill number is, because that's the bill that's spending all the money that we have for homelessness and emergency shelters. Instead of having that only happen H38, we want to make sure that all those discussions can happen in the budget, so we need this language in here so that it could be germane and discussed in the budget conference committee. And then the fourth, which is the rest of the pages here, is the remaining T-bill language around the pilot fund being added to the budget. I know we haven't really talked about these parts of the T-bill yet, unless you're maybe in appropriations or the transportation committee, but we're taking those items and placing them in the budget because they're budget items. Happy to answer questions. Thank you, Mr. President.
The question is, shall the Senate's proposal of amendment be amended as offered by the senator from Washington and others? Senator from Addison.
Thank you. May I inquire of the reporter of the amendment?
The reporter is interrogated.
I am looking at the third instance of amendment and related to the homelessness bill. I believe this is a bill that's in Senate Health and Welfare right now. Are the amounts that are in here the same as what was proposed is any of this in the budget at all?
The
yet?
21,183 on line 18, the first part line of this amendment is the number we had in the spreadsheets.
Okay.
I don't remember the $61 million number, but I have a strong feeling that is the right number.
Okay.
That is the number that's in the budget.
Okay. And is this in the House version of the budget?
The House version has these same totals, but I don't think this language is in the House budget because they were, the timing of the budget in H.R. 938 were traveling different. So 938 spends the same dollar amount, the 21,183.
Okay.
But in different ways. Right now, the Senate budget just puts that total in and is kind of leaving it up to Health and Welfare Committee to decide how it gets spent.
I see. Okay. So the bill will come out of that committee and rather than have potentially a conference committee on that bill, it would be dealt with in the budget. Is that the intention then?
That's the intention, to make sure that these items can be germane to the budget conference committees as their budget questions. And we want to make sure that was where the discussion would happen. It will also happen in the committee, and I don't know how the conference committee of the 938 will go, but the budget will also have that discussion.
Okay. Thank you, Mr. President.
Are you ready for the question? The question is, shall the Senate proposal of amendment be amended as offered by Senator Perchlik and others? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it. The question is, are there any other amendments? Senator from Addison.
Thank you, Mr. President. I have another small amendment that you'll get to see, and it's offered by myself and the Chair of Government Operations and the Chair of Appropriations Committee. This is an amendment related to the salaries of state's attorneys. And so those of you who were here a few years ago may recall that we passed a provision for the salaries of sheriffs and created a 3-tier system for sheriffs who do not have they're not certified law enforcement. They don't have a law enforcement certification. So that for sheriffs, there are 3 levels. There's level 1, 2, and 3 of law enforcement certification. So if they're only at level 1, if they're fully certified, they get 100% of their salary. If they're at level, and that would be a level 3 certification. If they lose level 3 and go down to level 2, or have never achieved level 2, then they would get a 10% knock, and then a 20% knock if they're at level 1 and not having achieved level 2 or 3. Or if they have no law enforcement certification, then they would have a 30% salary reduction. And that could mean that they never achieved that level, they never did the training and achieved the certification, or it could mean that they've lost their law enforcement certification through the Criminal Justice Council. They've done something that would mean they've lost their law enforcement certification. That is relevant right now in our state. That is true. So when we did that 2 years ago, we asked the Department of State's Attorneys and Sheriffs for a recommendation on whether or not we should do the same for state's attorneys who may lose their law license or not have a law license. As you might know, these positions are elected and there are no requirements, for their election in terms of their qualifications. But if you're not a law enforcement certified, it's hard for you to do the duties of a sheriff. If you don't have a law license, it's nearly impossible for you to do the duties of a state's attorneys. So they recommended, Department of State's Attorneys and Sheriffs, they recommended a similar construct. There's not levels of law licenses. You're either licensed or you're not. But their recommendation was a 30% salary reduction if a state's attorney does not have a law license, whether they never achieved one or whether they had their law license revoked. This is relevant right now in our state as well. And so this amendment would just implement the recommendations of the Department of State's Attorneys and Sheriffs. This went through both the Appropriations Committee and the GovOps Committee, and that's why those two chairs signed on as well. And so I'm asking the body for your support, their support, our support. Thank you, Mr. President.
Everyone's support. Are you ready for the question? The question is, shall the Senate proposal amendment be amended as offered by Senator Hardy? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and the bill has been amended as offered by Senator Hardy. Are there any further amendments prior to third reading? Senator from Chittenden.
I do have an amendment, but Legislative Council is still finishing the perimeter, so I would ask for a brief recess.
We'll
to
take a
check in with
brief
them.
recess to see where the amendment is. Please come to order. Senator from Chittenden Central.
Thank you, Mr. President, and thank you to the whole Senate for your patience. As I'm sure we all know, Legislative Council is rushing around doing a lot, and I'm told there was a formatting problem with this amendment that held it up for the past hour or so. That said, I will walk you through the amendment. Hopefully it is making it your way. Exempt salary growth, as the Chair of Appropriations spoke to the other day, has outpaced the growth of non-exempt salary growth. This is likely due to step increases being put into the base of the salary. In fiscal year 25, we would have spent $5.06 million less on exempt salaries if this was not happening. There are additional costs associated with these higher salaries that we're paying out in our pension benefits if any of those exempt positions have a defined benefit pension plan. High earners are seeing, in addition, our higher earning Vermonters are seeing on average a $57,000 federal tax refund, putting nearly $60,000 extra dollars in their pockets. While we are struggling to balance a budget that makes sure our most vulnerable Vermonters are fed, housed, and have health care, it seems reasonable to ask our higher earning exempt state workers to not take that raise in this year. These high earners would be getting an additional increase of 5.9% in fiscal year 1 of the Pay Act and 4.9% in fiscal year 2. By freezing these salaries, we ask these higher earners to give a little bit to our state as we grapple with a tight budget and to help those who are less fortunate than them. In doing so, we free up nearly $4.5 million in fiscal year 1 and a little over $4 million in fiscal year 2. If you think we're overspending, this amendment is for you. It will mean we spend less. The amendment does spend a small portion of that savings, about $450,000, to provide the Ethics Commission with the staff that they have asked for, and a Human Rights Commission with the staff that they have asked for to do their jobs. These two entities are critical to government transparency and to protecting the rights of Vermonters. In a year when we are seeing wealthier Vermonters get a windfall from the federal government, it seems perfectly reasonable that we ask that they get a little bit less. Again, this does not take anything away from what they get now. It simply does not move forward the raise that is proposed. And I would agree that we need to continue to look at how we solve the disproportionate growth. Our exempt workers over the past decade have had almost 43% wage growth, whereas our non-exempt bargaining staff have had just a little over 30% wage growth. So there's a significant discrepancy, and I think this is one step in solving that and putting forward savings to our budget in a year when we are saying that we can't fully fund feeding elders and people with disabilities, and we can't fully fund the basic needs of Vermonters. So I will say that I brought the concept forward to the Chair of Appropriations, but I was not able to bring the bill, as you are just getting a presentation of it for the first time because I did not have it. So I thank the Senate again for their patience, and I hope you will consider cutting the spending in our budget.
Senator from Washington.
Thank you, Mr. President. The senator from Chittenden Central did tell me about this, which I appreciate, but we didn't have time for the committee, so I'd ask the committee to look at it, so I'd ask for a short recess.
We'll take a brief recess. Will the Senate please come to order? Senator from Washington.
Unanimously
The
opposed.
Senate Appropriations Committee met and on straw polls was 7-0 against this amendment. I just would point out to the body that we did have some discussions along this theme in the Appropriations Committee, and that's why if you look at your addendum on page 78, E108, there is a study that kind of tries to look at how we could structure the formula different so we don't have this discrepancy in increases to higher salaried exempt employees. So with that, the Appropriations Committee asks for you to vote no on this amendment.
Are you ready for the question? Senator from Essex.
Thank you, Mr. President. I would vote no on this amendment. I wish that we would have taken a look at the nonprofits. We have 6,400 nonprofits in the state, and I was just looking at the salaries on some of them. Some are like 2.2 million, 400,000, 300,000, and on it goes. That type of pay seems to be really non-checked. I realize it's kind of a political football to look at the nonprofits and look at the salaries and stuff like that. But I think our state employees work really, really hard, all of them. And I want to pay them fairly, especially when we look at what the nonprofits in this state works. I didn't find one of the top 10 of the nonprofits, any of them, anywhere within, I didn't see the governor's salary anywhere within 50% of what these nonprofits are getting. So again, I wish we would just, if we're looking for more revenue, let's look at some of these nonprofits. I realize it's political football, but I think that we should have looked there. Thank you, Mr. President.
Are you ready for the question? The question is, shall the Senate's proposal of amendment be amended as offered by Senator Vyhovsky? Are you ready for the question? If so, all in favor, say aye. Aye. All opposed, nay. No. The nays appear to have it. The nays do have it, and the amendment fails. Are there any further amendments prior to third reading? Seeing none, listen to the third reading of the bill.
H 951, an act relating to making appropriations for the support of the government.
The question is, shall the bill pass in concurrence with proposal of amendment? Are you ready for the question? Senator from Washington.
Thank you, Mr. President. I just want to thank the senator from Orleans for pointing out the mathematical error that we had between the web report and the highlight sheet. The highlight sheet was the correct number. People were just ecstatic that somebody actually was looking at all the numbers. They said it was just put in there on purpose, but I do have if you want to have your web report have an accurate last page that matches the highlight sheet, I could make you a copy, but we do have that accurate. And it was just an error of an update, and the online version is the correct version. But thanks to Senator for Orleans for paying attention.
Senator from Franklin.
Thank you, Mr. President. Yesterday, the senator from Chittenden Central asked a question, and ironically, as we saw the Director of State Search and Sheriff's walk through the hall, we both merged on him at the same time. So at that particular point in time, he was concerned about the vacancy savings, as far as he had mentioned that they may have to start handing out RIF notices, and they were already in the process of hiring individuals that have to start considering out on July 1, and then quite possibly putting that into effect on August 1. Since then, rather than I could give you a walkthrough 101 on vacancy savings, but I'm sure you don't want to hear that. But since then, I've had the opportunity to receive advice from certain members, along with meeting with the Commissioner of the Department of Finance and Management, and once again meeting with the Director of the State Search and Sheriff's again this morning. And he is, at present, good with it. He said there is a contingency plan in place. They too have met and talked with the Commissioner of the Department of Finance, and they're well aware now of the avenues that are available for them through the Pay Act, along with even going through the Budget Adjustment Act some 5 or 6 months down the road here. So right now, they're continuing their hiring. There's going to be no RIFs, no layoffs, and there is a plan in place. So, thank you, Mr. President.
Are you ready for the question? The question is, shall the bill pass in concurrence with proposal of amendment? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. No. The ayes appear to have it. The ayes do have it, and we have passed H 951. I believe we are moving to H 949. We have on the calendar for action H 949, which passed the House April 21st of 2026. It was referred to the Committee on Finance, which reports it has considered the bill and recommends that the Senate propose to the House that the bill be amended as it appears in today's calendar, and that with such proposal amendment, it ought to pass. Affecting the expenditures of the state, the bill was referred to the Committee on Appropriations, which recommends that the bill ought to pass in concurrence with proposal of amendment as recommended by the Committee on Finance. Listen to the second reading of the bill.
H 949, an act relating to homestead property tax yields, the non-homestead property tax rate, and technical changes to education finance.
I recognize the senator from Washington District for the report of the Committee on Finance.
Thank you, Mr. President. There are two things in the financial realm we have to do every year. One is connect our tax code with the federal tax code, because you've heard about above and below the line. That's where everything flows from. The other thing we need to do is establish the yield, which is a polite way of saying the property tax rate. And I believe the Joint Fiscal Office sent everybody an email earlier in the year. Failure to either pass a budget or a yield has some dire consequences. The yield is really very simple. We take the voted budgets, the expenditures, we take the revenues in the ed fund, we subtract them from the expenditures, and what's left is the amount we need to raise on the property tax. And we used to set the property tax rate to raise that amount of money, but we got tired at one point of everybody yelling at us for increasing their property taxes. So instead, we set the yield. And the yield is the amount of money that a penny on the tax rate will raise. So you just figure out how many pennies you need to raise your tax rate by the amount of money you need to raise. This year, the yield is set at 9,395 income dollar, that's for the property dollar equivalent. The income dollar equivalent is 12,942, and the non-homestead property tax rate is at 1.648 for fiscal year 27. Some years, we have just attached that yield to the miscellaneous tax bill. Sometimes it's gone on the budget, it's a couple lines. Last year, I believe the bulk of Act 73 came over attached to the yield bill. This year, it's a little more not as complicated as last year, but a little more complicated. The House added a few things and the Senate changed a few things that they added. I think it's been agreed upon, as last year there was $125 million in one-time funding that had been set aside for use. At that point, HR 1 hadn't been passed. We didn't know there was going to be a shutdown, but there was a lot of talk federally about impacts on food stamps and Medicaid. And so we had that money and we set it aside for usage. And we did, the emergency board did use, I believe, about 25 million of that for when the SNAP payments got delayed. But there's 100.9 million there, and it has been agreed upon that that money will be used to buy down property tax rates. This is the third or fourth year we have put close to $100 million in to buy down rates. But there is concern, we keep buying down rates, which means we're artificially lowering them. Next year, we're pretty sure we're not gonna have $100 million. We just did the budget. Things are tight. And the odds are things will be tighter next year than they are this year. And so there will be a cliff. There will be a cliff either when we don't have the money to buy those rates down, or when the foundation formula goes into effect, there will be a cliff. So in order to kind of slope that cliff, the House voted their bill came over using 50% of that 100 million this year and 50% next year. That would have led to an average property tax rate of somewhere around, an increase of average 7%, which means some people would have been in double digits. The Senate decided not to do that. The voting committee was 7-0-0, which the chair was surprised but pleased with. We decided that we would use 100% of that money. That would have gotten us down to a property tax average increase of 3.6%. And Section 1 of the bill sets the yield. We used the 100%, we set the yield. Sections 2 and 2A, we set the yield, but we are concerned about going forward and about school spending and property tax increases. And so what we've done is we've added in here S220, which was the excess spending threshold, moving it down to 112% that this body passed 2 months ago, early in the session. But we wanted to make sure that got in. The House is still working on it. We wanted to make sure they knew we are serious. We can't keep buying down these rates, and we have to get spending down. Let's see. And so we added that in. We used 100%. And okay, the next two are pretty pro forma. Section 4, we gave $150,576 from the education fund to the city of Barry to compensate for an overpayment to the ed fund from their TIF district. We increased, and these were in both bills, it's an inflationary grant to the special education census grant. That was for $2,350 for fiscal year. And then sections 6 through 9, when we were setting the rates, it was mentioned, we're doing all of this. We've been doing all of this to buy down property taxes for property owners. But what about renters? We have a renter's rebate based on average rent, but we haven't done anything for renters. And so 6 and 7, and that's pretty technical, but 6 and 7 makes an adjustment to give an equivalent rebate to renters for 1 year only. So, and the impact of that is to raise the average property tax rate increase from 3.6 to 3.8%. So the committee felt that that was an acceptable deviation because we are helping more people. Everyone is struggling, rents are going up. And I believe that is the bill. Oh, and there is an amendment in your calendar, if I may speak to the amendment. It adjusts the effective dates. So it is a technical correction, Mr. President, if I may address that in the bill. And the vote was 7-0-0, and we asked this body to concur.
I now recognize the senator from Chittenden District for the report of the Committee on Appropriations.
Thank you, Mr. President. We did have a general discussion about the yield bill as has just been described to you. Most of what we concentrated on was obviously the buy down because that is moving a large sum of money into the ed fund for the purpose of buying that rate down. And in general, we went along with the language that came out of finance, and our committee vote was 7-0-0. Thank you, Mr. President.
Senator from Washington, this would be the appropriate time to report on the amendment that is in the calendar.
Which, let's see, make sure I get the right bill, I keep getting these mixed up. 715 and 720. 715 is our amendments to the yield bill. 720 is, on page 720, is the adjustment to the effective dates to reflect the renter's credit and make, it's a technical correction.
Thank you, Senator. The question is, shall the recommendation of amendment of the Committee on Finance be further amended as recommended by Senator Cummings? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. Ayes have it, and we've amended the bill. Now, the question is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Finance? Are you ready for the questions? Senator from Essex.
Thank you, Mr. President. I want to thank the committee for their hard work. It didn't make sense to me why the House didn't include all the dollars that you did to buy down the rate when Vermonters are really struggling. I'm hoping that, I can imagine there might be a committee of conference, and I hope that the Senate will hang tough in the areas that I'm in. 3 or 4%, 1% makes a difference to a lot of my budgets of the people that I deal with. And again, I really appreciate what you've done. It's a significant, again, in my area, it's a significant decrease as far as to what the House sends over, and my wish is that you hang tough in conference. Thank you, Mr. President.
Are you ready for the question? Senator from Addison.
Thank you, Mr. President. I just wanted to give a shout out to the section of the bill about renters. This was something that I worked on, and I was really happy that it got into the bill. If we're buying down the property tax rate for people who own their property, I thought it was very important that we also give the same kind of benefits to people who rent. And so this is just a one-year buy down of, or increase of the renter credit, but it is sort of equivalent to what we're doing for property tax, property owners, and really, really helps low-income renters in all of our districts be able to stay in their homes and get the same benefits with this buy down that property owners get. So I appreciate the Finance Committee working with me and getting this into the bill so that I could support the whole package. Thank you, Mr. President.
Are you ready for the question? Senator from Chittenden Central.
Thank you, Mr. President. I also want to thank the committee, and I'd like to thank them for making this a two-part bill, basically. Three-part with the renter's credit. But what I'm thinking about is the buy down and the addition of the language from S220 into this bill. I think that was a very necessary addition. We've been to this well before, where we're buying property tax rates down, and we're doing so at the urging of our constituents. I take us back to last election. It was not ambiguous. People are suffering from their property taxes, and they wanted relief. The House, as has been reported, the other body, has put forward a proposal that I think is inadequate, and the language of 220, I believe, is still basically on their wall. They have not acted on that. So putting it into the yield bill makes absolutely certain that the conference will be taking up both short-term spending and the buy down of the rate. So I can, in good conscience, vote to put another $120 or so million into buying the rate down because we've reduced the excess spending penalty in this bill from 118% to 112%. And that will give us a head start on next year. So with that said, again, my thanks to the committee, and I am an enthusiastic yes on this bill. Thank you, Mr. President.
Are you ready for the question? The question is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Finance? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay.
Nay.
The ayes appear to have it. The ayes do have it, and you've proposed to the House to amend the bill as proposed by the Committee on Finance. Now the question is, shall the bill be read a third time?
Roll call.
Roll call has been requested, and when the vote is taken, it shall be by roll. Are you ready for the question? If so, Secretary shall call the roll.
Senator Baru.
Yes.
Senator Beck.
Yes.
Senator Benson.
Yes.
Senator Bonner.
Yes.
Senator Brennan.
Yes.
Senator Brock.
Yes.
Senator Chippian.
Yes.
Senator Clarkson.
Yes.
Senator Collmore.
Yes.
Senator Cummings.
Yes.
Senator Bueller.
Yes.
Senator Hardy.
Yes.
Senator Harrison.
Yes.
Senator Hashim.
Yes.
Senator Heffernan.
Yay.
Senator Ingalls.
Yes.
Senator Lyons.
Yes.
Senator Major.
Yes.
Senator Matos.
Yes.
Senator Morley.
Yes.
Senator Norris.
Yes.
Senator Perschlick.
Yes.
Senator Plunkett. Yes. Senator Ron Hinsdale.
Yes.
Senator Bohosky.
No.
Senator Watson.
No.
Senator Weeks.
Yes.
Senator Weston.
Yes.
Senator White.
Yes.
Senator Williams.
Yes.
Those voting yes, 28. Those voting no, 2. The ayes have it, and you've ordered third reading of H 949. I believe we are now going to H 933. Senator from Chittenden.
I was hoping we might go to the top of the calendar, Mr. Chair.
We will go to the top of the calendar, which brings us to H 940 for third reading. Are there any amendments prior to third reading? Seeing none, listen to the third reading of the bill.
H 940, an act relating to miscellaneous public utility subjects.
Question is, shall the bill pass in concurrence? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and we have passed H 940 in concurrence. We have on the calendar for action H 46, which was passed by the House on April 22nd of 2026. It was referred to the Committee on Health and Welfare, which reports it has considered the bill and recommends that the Senate propose to the House that the bill be amended as it appears in today's calendar, and that with such proposal of amendment, the bill ought to pass. Affecting the expenditures of the state, the bill was referred to the Committee on Appropriations, which recommends that the bill ought to pass in concurrence with proposal of amendment as recommended by the Committee on Health and Welfare. Listen to the second reading of the bill.
H 46, an act relating to the Rare Disease Advisory Council.
Recognize the senator from Orleans districts for the report of the Committee on Health and Welfare.
Thank you, Mr. President. Act 46. Rare diseases impact on average 1 in 10 Americans, so approximately 64,000 Vermonters. Vermont Department of Health currently produces data. What it can't do is translate that information into coordinated policy action. The Rare Disease Advisory Council, or I call it RDAC, which is created by this legislation, will look to identify gaps, elevating the patient's voice, and giving lawmakers a trusted expert body. Currently, there are gaps in Vermont's rare disease care. There's a lack of provider awareness. Parents are forced to advocate for basic care. There's no centralized expertise. The care is fragmented, inconsistent surveillance, emotional and administrative burden on families. No mechanism for lived experience input whatsoever currently. Mr. President, may I read some brief testimony from an individual that testified before our committee?
You may.
I became a medical professional because of what this system did to my daughter. In her journey, I saw firsthand how the system fails when it's confronted with the rare or the complex. I saw the silence that happens when doctors don't have the answers. I saw a mother, myself, being ignored while my children suffered. I decided then that I would never let that happen to another child if I could help. I am training to be the voice that I know another child in Vermont will need when they are facing a terrifying diagnosis. But as much as I can do as one nurse or one assistant, I cannot fix a broken system alone. That is why we need H46. My fight isn't just in the past, it is my everyday reality. 2 of my children live with Beckwith-Weidman syndrome, or BWS. Our lives are dictated by the scan. Every 3 months, we are in a clinic for ultrasounds, chest x-rays, urine cultures, and blood work to check for tumors. As someone who is studying for the nursing field, I understand the clinical high stakes of the BWS, but as a mother, I see the gaps in Vermont's care. We are often the ones teaching the providers about the protocols. We are the ones coordinating between specialists who don't talk to each other. H46 is the bridge between a parent's intuition and a child's survival. A Rare Disease Advisory Council ensures that the lived experience of families like mine is finally used to build a better roadmap for Vermont. Now, going through the section by section of the bill, there's 2 findings. Lack of awareness contributes to common and harmful obstacles, and it's also on page 1663 in your calendar today. Also, number 2, with support of the National Organization for Rare Disorders, various patient organizations, stakeholders in the rare disease community, Rare Disease Advisory Councils are enabling states to strategically identify and address barriers. Section 2 is new. It adds Chapter 19, the Rare Disease Advisory Council. And there was quite a bit of discussion on this. This has created the Rare Disease Advisory Council within the Department of Health to provide guidance and recommendations to the public, General Assembly, and other government agencies and departments as necessary regarding the needs of individuals living with rare diseases in Vermont. And B, the membership and the way it came over to us, or there was discussion in the bill, dealt with, a lot of them were the Committee on Committees, and the Senate would make appointments, and the Speaker of the House would make appointments, and there was a lot of changes here. We wanted to refer to the experts in these fields, and you're going to see a lot of Department of Health individuals, commissioners, and such. They shall be composed of 2 individuals living with a rare disease, at least of one is an older Vermonter appointed by the Commissioner of Health, a parent or guardian of a person living with a rare disease, appointed by the Commissioner of Health or designee, Commissioner of Dale or designee, a representative of the Health Equity Advisory Commission. Had to look that one up, didn't know exactly what it was, but I do now. An academic researcher who conducts the rare disease research, appointed by the Commissioner of Health, physician practicing in Vermont with experience treating a rare disease, appointed by the Vermont Medical Society, nurse practicing in Vermont with experience treating rare diseases, appointed by the Vermont chapter of the American Nurses Association, pharmacist, which is important, practicing in Vermont, appointed by the Vermont Pharmacists Association, a geneticist or genetic counselor appointed by the Commissioner of Health, and any other persons deemed necessary by the Commissioner of Health. So the Department of Health is taking a pretty strong role in this advisory council. And then it goes through and talks about the members of the advisory council shall be appointed for staggered 5-year terms. 3, the advisory council may collaborate with any other relevant stakeholders it deems appropriate, including the National Organization for Rare Disorders. So I envision them not just working in the state of Vermont, but nationally with national organizations. Powers and duties, the advisory council may conduct the following activities for the benefit of individuals impacted by rare diseases in Vermont. They may convene public hearings. 2, they can provide testimony and comments on pending legislation and rules that impact Vermont's rare disease communities before this body, in the House, General Assembly, and other state agencies. 3, in consultation with experts on rare diseases, develop and provide policy recommendations that identify conditions for the Department of Health to consider as part of appropriate screening guidance and recommendations. They can support timely patient access to diagnostic services and treatment, enhance quality of services provided by rare disease specialists. Subsection 4, any other activities identified by a majority of the advisory council. And then there's assistance, and Department of Health's going to help some. They're not going to be doing the whole thing. The Department of Health shall maintain a web page on its website that contains notices of upcoming meetings, meeting minutes, public comments, and reports. Reports as needed, the advisory council may submit any recommendations for legislative action to the House Committee on Healthcare and on Human Services to the Senate Committee on Health and Welfare. The meetings, the Commissioner of Health shall call the first meeting of the Advisory Council. The Advisory Council shall elect a member to serve as the chair. There's going to be quarterly meetings held in person or remotely, electronic platform in accordance with Vermont open meeting law. Majority of the membership shall be a quorum. Compensation, I think this is where you'll have someone from appropriation discussing the per diem. And then section 3, so section 2 is all about setting up the advisory council, basically. Section 3 is long COVID resources for primary care providers and patients. The Department of Health shall collaborate with the University of Vermont Medical Center, Vermont Medical Society, and patients with lived experience of long COVID. We received some testimony from individuals with long COVID, which I knew nothing about. And it's pretty scary, to say the least. What can happen to those individuals and what is happening to those individuals here in the state of Vermont. They can identify existing evidence-informed standards, best practices, and training for primary care providers regarding long COVID and distribute these resources through the department's website and to primary care providers. So there's been a disconnect that's been going on with this too, with long COVID, and I think this will help straighten things out. Number 2, in collaboration with the Department of the DALE, identify support services or other resources for long COVID that include a range of peer community-based programs, such as long COVID support groups. And we heard that from some testifiers that was really important and critical because you kind of get stuck to your home and you kind of lose sight of interaction with other folks. And so it was really impactful to those individuals. Such long COVID support groups at the University of Vermont Medical Center, the Vermont Center for Independent Living, or another entity, and strategies to support patients who are homebound or at risk of becoming homebound. B, on or before February 1, 2027, the Department of Health, in collaboration with the Department of Disabilities and Independent Living, shall present recommendations to the House Committee on Human Services and the Senate Committee on Health and Welfare, providing long-term disability supports to individuals experiencing long COVID. And the effective date is, this act shall take effect on July 1, 2026. And some of the individuals that we heard testimony from, we had 2 that had experiences with, lived experiences with rare diseases. We also had 4 individuals from the Department of Health give testimony. We had the National Organization for Rare Diseases give testimony. We had the Pediatric Cancer Advocate give testimony on that. And with that, Mr. President, the vote in committee was 5-0. I didn't get it wrong this time. I didn't give you the House vote. Thank you. We hope the Senate concurs.
Good work, Senator. I recognize the Senator from Chittenden District, Senator Lyons, for the report of the Committee on Appropriations.
Thank you, Mr. President. Appropriations reviewed the possible expenditures in the bill and found that they have a de minimis effect both for the per diems and also for the work through the Department of Health that they will be accomplishing through their current budget. So the committee voted 7-0-0 in support of the proposal. Thank you, Mr. President.
The question is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Health and Welfare? Senator from Chittenden Central.
Thank you, Mr. President. May I inquire of the presenter of the report?
The presenter is interrogated.
I have a couple questions just about definitions. I'm wondering if there's a statutory definition somewhere that I don't see that defines what a rare disease is.
Mr. President, be quite honest with you, I really struggled with that definition as well. I think I talked to my chair about it. I went and I looked up all kinds of definitions, got AI involved in it even. And there is a definition, but to be quite honest, I truly didn't like the definition, but there is a definition in there that people have in a lot of different areas, Mr. President. But no.
The presenter, remember what that definition is?
I do not. I will have to get back to the member on third reading.
That's fine. My other question is if there's a definition somewhere of an older Vermonter. Older than who?
Older than me. I would say anyone over 18 or 20 would be considered an older Vermonter.
So not someone under the age of majority is what this
Correct.
definition means?
That's right. That's true.
Okay.
President.
I thank the reporter, and I thank the committee for its work on this bill as someone who lives with what was previously thought to be a rare disease. But as we learn more and more, due to work like this, we've learned it's actually not so rare. Though I do still have to go to Boston for treatment. I so appreciate that this is an area where we don't do enough work. We don't acknowledge the real harm of not knowing what's going on and being forced to travel long distances to seek medical care. And in the worst case scenarios, not being believed that anything is wrong at all. And so I want to express my deep gratitude to the committee for moving forward with this bill. And I will wait for the definition from the reporter on third reading.
Are you ready for the question? The question is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Health and Welfare? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and you've proposed to the House to amend the bill as proposed by the Committee on Health and Welfare. The question now is, shall the bill be read a third time? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and you've ordered third reading of H 46. We have on the calendar for action H 582. It was passed by the House on March 11th of 26. Was referred to the Committee on Health and Welfare, which reports it has considered the bill and recommends that the Senate propose to the House that the bill be amended as it appears in today's calendar, and that with such proposal of amendment, the bill ought to pass. Listen to the second reading of the bill.
H 582, an act relating to adult protective services.
I recognize the Senator from Orange District, Senator Benson, for the report of the Committee on Health and Welfare.
Thank you, Mr. President. May I present the bill with the amendment?
You may.
Thank you. So this bill, H 582, an act related to adult protective services, basically increases the protections for vulnerable adults. It actually does kind of two things. It provides a mechanism for reporting abuse of vulnerable adults, but it also provides some protection for somebody who may be accused of mistreating a vulnerable adult, and a process for that individual to express and their grievance and actually have that waived. So with that, I will present the sections of the bill. Section 1 is definitions, and it provides definitions such as what is neglect, what is a fiduciary. And if you look at page 1667 of today's calendar, that's where you will see the amendment that the Health and Welfare Committee proposed to what came over from the House. And that is to deal with a fiduciary. And the Health and Welfare Committee felt that the phrase or a advanced directive was not actually a definition of a fiduciary and should be struck out of the definition.
So that is the only change that the Health and Welfare Committee made to the bill as it came over from the House. Section 2 is a section that talks about the nature and content of report and to whom it should be made. So this section basically defines where, if you believe that a vulnerable adult is being mistreated, where that complaint would be filed. So by example, if the individual is in a licensed facility or being treated by a licensed individual, then that complaint would go to the licensed board that has jurisdiction over that facility or over that individual providing the treatment. And then it talks about how it would, if the licensed entity receives the report of allegation, neglect, or of a vulnerable adult under the new process, this licensee entity would notify Dale's Audit Protection Services program that has received the report and is acting upon its accordingly. If the licensing entity defines neglect, alleging or within a state licensed facility or program or by a state licensed individual, the licensing entity would also report it to the Adult Protective Services program. And then in section 3 is where it has the protection for the individual who the allegation may be made against, where that individual has some recourse through the Human Services Board. And essentially, if in fact that individual's that's their income, and if they were accused, they would lose their ability to earn an income, that they will be heard within a short period of time so that the issue could be resolved. And then section 4 is the effective date, which is October 1, 2026. The Health and Welfare Committee heard from the Office of Legislative Counsel, Department of Disabilities, Aging and Independent Living, the Vermont Healthcare Association, and the Vermont Medical Society. The bill was voted out of committee 5-0-0, and we'd ask for the Senate support. Thank you.
The question is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Health and Welfare? Are you ready for the question? Senator from Franklin.
Thank you, Mr. President. May I interrogate the presenter of the bill, please?
The presenter's interrogated.
Thank you, Senator, for your presentation on this bill. I just have one quick question, and maybe I missed it, I don't know. The vulnerable adult, that's something that's already in statute, the definition, because I don't see it in the bill here.
That is. Yes, Mr. President, the answer is yes, that is in statute, and this amends existing statute.
I thank the presenter. Thank you, Mr. President.
Are you ready for the question? Senator from Chittenden Central.
May I inquire of the presenter of
The reporter's interrogated.
hopefully this is a fairly easy question, but October 1st is a fairly unusual effective date. I'm wondering if there's a reason for that effective date.
Mr. President, I do not recall that there was a specific discussion about that date other than that was what was requested.
I thank the presenter.
Are you ready for the question? The question is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Health and Welfare? All in favor, say aye. Aye. All opposed, nay. The ayes have it. And you have proposed to the House to amend the bill as proposed by the Committee on Health and Welfare. Question now is, shall the bill be read a third time? Are you ready for the question? If so, all in favor, say aye. Aye. All opposed, nay. The ayes have it, and you've ordered third reading of H 582. We now have on the calendar for action H 778, which was passed by the House on April 22nd, 2026. Was referred to the Committee on Natural Resources and Energy, which reports it has considered the bill and recommends that the Senate propose to the House that the bill be amended as it appears in today's calendar, and that with such proposal of amendment, the bill ought to pass. Affecting the expenditures of the state, the bill was referred to the Committee on Appropriations, which recommends that the bill ought to pass in concurrence with proposal of amendment as recommended by the Committee on Natural Resources and Energy. Listen to the second reading of the bill.
H 778, an act relating to dam safety.
I recognize the senator from Rutland District for the report of the Committee on Natural Resources.
Thank you, Mr. President. Those who prefer to follow along, you can be found on page 1667 in your calendar. This bill does three things. It clarifies emergency authority, so the governor and emergency management can order evacuations in the event of a dam failure, even if local officials have not acted. It launches a pilot program to build real, actionable emergency operation plans for high hazard dams, and it provides funding to get that work done and requires a report back to the legislature with a statewide path forward. This is a public safety bill. It closes ambiguity, strengthens preparedness, and ensures we're not reacting to a disaster, we're planning for it. Section 1, emergency authority, clarifies that municipal authority does not limit the governor or the emergency management the director of emergency management. It allows immediate evacuation orders when there is a dam failure or imminent risk. Section 2, emergency operation planning pilot project. It requires the development of emergency operation planning for 2 high hazard dams in the state. It includes evacuation planning, coordination, and communication systems. It requires a report back to the legislature by July 1st, 2028. Section 3, appropriations, requires $250,000 in emergency management and $125,000 to the Department of Environmental Conservation. Section 4, the effective date is effective upon passage. Bill strengthens emergency authority and preparedness for dam safety, and the Senate Natural Resources and Energy Committee voted this bill out 5-0-0 and recommend passage. We received testimony from the reporter, one of the sponsors, Executive Director of the Foundation for Resilient Montpelier, the Director of the Vermont Emergency Management, Department of Public Safety, the Dam Safety Program Manager, Chief of Rescue Inc., the Administrator of the Department of Environmental Conservation, Dam Safety Program, and our Legislative Council. Thank you, Mr. President.
Senator, that was the best dam report I've heard all day. I recognize the senator from Washington for the report of the Committee on Appropriations.
Thank you, Mr. President. The Senate Appropriations Committee did take a look at this bill and does have a couple of appropriations in it. $250,000 for emergency management, as well as $125,000 for DEC, and both of those appropriations are included in the budget, and so thought it was appropriate to let it continue on. So this passed out of appropriations on a vote of 7-0-0. Thank you.
The question is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Natural Resources and Energy? Are you ready for the question? Senator from Addison.
May I inquire of the presenter of the bill?
The reporter's interrogated.
Mr. President, where are these 2 dams? In the state of Vermont?
Thank you, Mr. President, for the question. I believe one of them is the Wrightsville Dam, and the other one is the Waterbury. But there are more than 800 dams in the state of Vermont, and a lot of them have been allowed to get into disrepair. So, and we have a small team with the DEC that is working to get all of them under control.
I thank the presenter.
Thank you, Mr. President.
Are you ready for the question? The question is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Natural Resources and Energy? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and you've proposed to the House to amend the bill as proposed by the Committee on Natural Resources and Energy. The question now is, shall the bill be read a third time? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and you've ordered third reading of H 778. Senator from Chittenden Central.
Thank you, Mr. President. At this time, I would move that the Senate suspend its rules in order to message the actions taken on H 951, appropriations in support of government, to the House forthwith.
The senator from Chittenden Central has moved that the Senate suspend its rules in order to message our actions on H 951 to the House forthwith. Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and the motion carries. Senator from Chittenden.
Confusion, Mr. President. Have we left the orders of the day?
Oh, we have not left the orders of the day, but I assume that you wanted to not carry on in the orders of the day.
Absolutely. Thank you, Mr. President.
That completes the orders of the day. Senator from Chittenden.
Thanks to the body as well. That is good work to move the budget along. It is called the last train for a reason. That train, as you all know, may idle for a little while this time around because for conditions that you're all familiar with, it is connected to our work on the education bill. With that said, Mr. President, I would move that pending announcements, the Senate stand in adjournment until 11 a.m. Thursday, April 30th, 2026.
Are there any announcements? Senator from Washington.
Thank you, Mr. President. Senate Finance will meet at 1:15, but I'm going to ask them to show up at 1, and anyone that might have amendments to either the yield or the miscellaneous tax to bring them to us at that time, so we'll have at least a few minutes to know what's out there.
Senator from Washington.
Thank you, Mr. President. Senate Appropriations will meet at 1 o'clock.
Senator from Rutland.
Thank you, Mr. President.
Government Operations will meet at 1:30.
Senator from Windham.
Thank you, Mr. President. Senate Institutions will meet at 1:45.
Senator from Bennington.
Mr. President, the Education Committee will meet at 1:45, and I ask people to be there a few minutes early so that we can actually start at 1:45.
Are there any further announcements? Senator from Essex.
Mr. President, there seems to be some confusion as far as some of the folks that are trying to sign up to run or even the people that are running for re-election as far as their finance campaign statements. And it seems to be a little bit of a battle between Secretary of State's office and the Ethics Committee. And I know that the answer to will be to, well, if you want that to be resolved, well, just hire the position. Well, we were able to get by that for 200 years before that is. So I would hope that the Secretary of State's office and the ethics panel can figure out what the delay would be. It's causing consternation, I'm sure, with anybody who wants to be an elected official or at least sign up to be one. So I'm hoping that they can get through that problem fairly quickly. Thank you, Mr. President.
Are there any further announcements? Senator from Chittenden Central.
I would just like to let anyone who's having those difficulties know that I am in conversation with both the Ethics Commission and the Secretary of State's office, and if people need that form, I'd be happy to help get it to them as soon as I have the correct one.
Are there any further announcements? Seeing none, the senator from Chittenden Central has moved that the Senate stand in adjournment until 11 a.m. Thursday, April 30th, 2026. Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and we'll stand in adjournment until 11 a.m. Thursday, April 30th, 2026.